First aid. First aid, I think, something that everybody should know, at least the basics of.
Well, you do a bit of it at school, don't you? And I did a first aid course when Jack was born. You know, it's that kind of baby thing. So we all know a little bit, I think.
You had to perform first aid on me, really, during the week a number of times.
I had to be Nurse Ruth.
When I was...
Yes.
When I nearly passed away.
I brought you back.
Anyway,
I brought him back.
Anyway, but it's one thing talking about humans and what you would or what you could do for a human, but apparently there are no courses to do first aid on pets until now, because in the studio now we have got Keith Slateholm. Keith has devised one of these and he's here today to show us some of his techniques, really, and for that we've got a model. And the model, you may look here and think it's this lovely blonde girl, but who's called Charlie. But Charlie, you own the lovely Bo.
Yes.
Here. And tell us about Bo.
She's a golden retriever, Labrador. She's 8 years old.
And she's going to perform everything now that Keith's going to show us here.
Model.
So Keith, my friend, I think this is excellent. I mean, if anything happened to Bo, you'd want to get in there and intervene.
Yes.
But could you? That's the question.
Depends.
It depends. Right, Keith, tell us. First of all, we're going to start with bleeding. And bleeding, it could be the tail, it could be the paw. In this case, you're going to show us...
The ear.
The ear,
yeah.
OK.
Dogs often cut their ear quite easily. So it's just really... Anything you want to do is just exactly the same as with a human. You want to, in this case, look after the animal, talk to it. Obviously, we're not replacing vet care here. We just want to try and help.
Yeah, we must make that very clear. You're saying this is just in the interim period until you can get them to the vet.
Reduce the stress so that by the time the dog gets to the vet, or cat or whatever, we can reduce the stress, reduce blood flow. So something like the ear will often maybe cut just down the bottom, they just get caught. Often the blood going in the ear can upset them, so maybe just pop a little bandage on. Now, these are just standard bandages you'd have at home, normal first aid kit.
Now, that's got a bit of dressing on it.
Yeah, it's just a gauze pad. So that will just go over it, just absorbs the blood a little bit, and it applies a little bit of pressure to try and stop the bleeding. There's less blood about, it's less distressing. So you pop it over, you are covering over the dog's hearing, so you need to try and make sure that the other ear is kept clear. And again, we're going underneath the neck, so we don't want to put it on too tight. We're just trying to stop movement. OK.
Well, we get the idea with that, and hopefully the dog wouldn't be too distressed. Now, when it comes to a broken bone, should you tackle that or not? Well,
broken bones are a lot more serious, because, you know, as soon as you move a dog, there's a problem, but you've probably got this sort of stuff at home anyway. Something just like a magazine can just secure the leg quite nicely. So all you would do in this case, she'll do it for us, but is just pop the... something like a magazine. Should always be laying down.
You lie down, Bo.
You lay down?
We get the idea.
Lie down.
So we just go over, show me, pop it over onto the arm, and then you just use some tape and just stick around.
There she goes.
Now imagine if we had the bandage around the ear and that. Bo would look very different at this stage. OK, so then we get to this whole stage of resuscitation and respiration. Cardio, really, is what we're talking about. And we're not going to use Bo for that one, we should say. You've brought along another model for this one.
So this is one you use on your courses, isn't it?
This is one we used on classroom courses and the online courses we do as well. So, you know, it's a Resusci dog.
Bo's very interested in Resusci dog.
Really what we're looking at here is if a dog's drowned or there's been a case of poisoning or any other problem, or smoke inhalation things, you want to try and get the dog breathing. So to start with, you can just pop your hand over the chest and just feel whether it's breathing. Put your ear down and listen to see if you can feel anything. You can also feel the pulse. Dog would always lay on the right-hand side because the heart's nearer the surface. So if you did need to give breaths, then just pull the tongue to one side, that opens the airway up, just keep the neck steady, and then you're just sealing the mouth and you just blow into the nose.
So right, so this is what's different. You're blowing into the nose, not the mouth. The mouth's too big, I presume.
The mouth's too big in this case, but if it was a cat or any other smaller animal, then no problem. You could seal around the mouth and the nose.
And do you think you could do that, Charlie, if you went through one of these courses? Do you think you could perform that on an animal, on your beloved Bo?
I'd like to think so, if you actually went through a course.
You'd want to, wouldn't you, if you thought it could save their life?
There's the reason we're talking about all of that, of course, is there's a man who actually did this, and he used this mouth-to-muzzle technique, is what it's called. And we'd like to welcome Charlie. We'll say goodbye to you and Bo. We'll let you go. And we'd like to bring in firefighter Mick Dunn and Sonny here, because little Sonny, who's a Westie Cross, wouldn't actually be here today if it wasn't for you, Mick. Tell us the story about little Sonny here.
Sonny.
Well, 2 weeks ago we had a house fire, domestic property, so we turned up and we all do our usual role. I was a casualty carer. as the breeding apparatus team was searching the property, they passed me out Sunny in a very limp and lifeless state. So I tried to hide her away from the public eye, but as I put her down, she took a very shallow gasp of air. And sometimes you get a little bit of trapped air in pets. So I waited 10 seconds, did it again. So I just instinctively sort of covered her like a mouth and made a seal, give a good couple of blasts of air. She started to breathe a little bit more frequently. So we took hold of the oxygen cylinder and we tried a mask on the actual face, but they don't fit a canine muzzle. So we actually cut the line and just popped the tube into her mouth and give her some full flow oxygen. And about 30 minutes or so of chest massages, warming up and just observing.
30 minutes?
30 minutes,
That's a long time.
Yeah, she started to get a bite reflex back pretty soon. Then she started to sort of limber up a little bit and twitch.
No, do you have training to do this?
No, this is pure instinct. At the moment, our
brigade?
service doesn't do animal sort of first
Well,
aid.
I think it's incredible, Keith, that his instinct took over and that he did this, your whole instinct to preserve life and save life.
Yep.
And I spoke to Sonny's owner, and she said, look, you know, the rest of it were just physical possessions, but Sonny was
you can't replace
living and breathing,
pets,
and you've kept Sonny that way. But a lot of people just would not have bothered, Mick. They wouldn't have seen the point. They would have said, this is a dumb animal.
No. I'm a dog lover myself, you know, and I'd do it again in a heartbeat, you know.
Do you have your own animal?
I do, yeah. I have a boxer.
It just would be nice for people to think that they could if they had to, Keith, wouldn't it?
Yeah, we want to make it easy for people by online classroom courses.
I think we've got a few of your tips, haven't we, that we can put up here if you just want to talk us quickly through these.
Yeah, if you have
and
a
these are your
problem,
CPR tips.
yeah. If you have a problem with a dog with breathing, look for signs of life. Feel on the chest, just underneath the leg, you'll feel a pulse. Also, you can do mouth-to-nose resuscitation. Just seal the mouth, pull the tongue out slightly, and you can blow into the nose. And you try and do a breath every about 5 seconds. And then, if there's no pulse, just do chest compressions just with one hand. But most importantly, we've got to make sure we get to the vet as soon as possible, and also phone the vet.
I think the lovely thing is so many people have so much love for their pet, and you guys, between you, you're demonstrating how you can preserve that life and you actually put it into action. Mick, when you look at little Sonny, what do you feel? What do you feel today?
Oh, it's extremely rewarding, you know. I mean, to say I preserve any life is great, you know, but obviously someone's a beloved pet. I mean, last thing you want to see, like, when you go home to a sort of burnt-out house, you know.
It's going off.
You don't want to think you've lost your treasured pet in that as well, you know. So
and are your colleagues from Humberside Fire and Rescue watching this morning?
I'd hope there would be.
I hope they would. And give them a wave there, camera 2. Hi, everybody. Thank
there
you so
are.
much.
And the question I just want to ask everybody today, after hearing the stories from these two men and after seeing their little doggies, could you, would you, should you? It's very, very interesting. Thank you very much indeed. Excellent stuff. We're going to do the mum makeovers for Mother's Day right after this, so don't forget that as well.
Yes, and
it
also,
is Mother's Day on Sunday.
and talking Mother's Day, we've got Paul Ross and his mum Martha. They're helping Phil Vickery in the kitchen today. Well, Martha's probably helping. He'll be making a complete hash of it, probably, Paul.
And also, we've got a very interesting debate coming up. We've got two women, one who basically says she feels she's too big for sex, and the other one thinks, no, I'm absolutely fine about that. Right after this.